Gentleman may proceed.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material in H.C. Resolution 35.
Without objection, so ordered.
Mr. Speaker, I yield myself 3 minutes.
Gentleman is recognized for 3 minutes. Gentleman will suspend. House will be in order. The gentleman may proceed.
Mr. Speaker, House Concurrent Resolution 35, if adopted, will add provisions to the continuing resolution, H.R. 1437, to prohibit any funds in this Act or any previous Act from being used to implement the Patient Protection and Affordable Act. Most importantly, the resolution will guarantee that our colleagues in the Senate will take an up or down vote on this important issue. I think we can agree this is a vote that the American public has called for and a vote that we owe the American public. Mr. Chairman, today the House approved a historic spending agreement that cuts nearly $40 billion in federal spending. When signed into law, Congress will have achieved the first step in addressing our nation's ballooning deficit. Our economy still suffers from apathetic growth, and millions of individuals remain unemployed. At a time like today, when the federal government is running record deficits, coupled with significant unsustainable liabilities like Medicare and Medicaid, we simply cannot afford this $2.6 trillion entitlement program. It only seems fair that a vote on the billions of dollars in both mandatory and discretionary money required to implement the health reform law is part of the discussion. I, along with my colleagues in the House, have long argued for a repeal in this law. Several members have also maintained that for this strategy to be successful, it must include efforts to defund the enforcement and implementation of the law through the appropriations process. With the inclusion of this language in the CR, we will move one step closer to reaching that goal. Under new leadership, the House has already begun to tackle the health care law from previous fronts. In January this year, the Chamber approved a full repeal of the health care law. Additionally, during the historic open debate on a previous continuing resolution, H.R. 1, this Chamber debated and approved various provisions that would prohibit or slow the implementation of the health care law by restricting annual appropriations from going toward implementation. In fact, just yesterday, we passed a measure that would repeal just one section of the health care law that included $17.5 billion in mandatory automatic appropriations. This resolution will go farther by eliminating all the funding, both mandatory and discretionary, which is clear that we presently cannot afford. It will also allow time for us to offer up new solutions to our nation's health care challenges that will not have long-term negative consequences for job creation and economic growth. Putting all arguments on the merits of the health care law aside, this resolution simply ensures accountability is restored over how hard-earned taxpayer dollars are being spent. The health care law turned hundreds of billions of dollars in discretionary spending into mandatory spending. I yield.